Hi, this is Dr. Otto Janke for the Chiropractic Research Reports, brought to you by the New York Chiropractic Council. The intention of the Chiropractic Research Reports is to give you the latest information, research, so you can tell your communities, your practice members, and help you be a better doc. Two articles for you this time. Two articles for you. The first is, have you ever had a patient come in who has vertigo or disequilibrium? Disequilibrium. We see it as vertigo in our office, and we see it often. And we get phenomenal results with it, phenomenal results. And this is an article from the journal Manual Medicine, and this is from 1983. 1983. Disequilibrium caused by a functional disturbance of the upper cervical spine, clinical aspects and differential diagnosis. In primates, equilibrium, the subjective orientation in space, requires both an intact peripheral vestibular apparatus, vestibular nerve, and or vestibular nuclei, and upper cervical spine somatosensory integration. Now we're talking. Now we're talking. The importance of the proprioceptors in the cervical region is clearly demonstrated by locally blocking the receptors with anesthetics. The levels of proprioceptors responsible for disequilibrium is located at the C1 through C3 levels. Pretty important stuff right there. And about 50% of the receptors are found in the joint capsules of C1 through C3. The rest are located in the deep neck musculature. A subjective and objective disequilibrium may be caused by a disturbance, this is what they say, by a disturbance in the proprioceptive regions of the upper cervical spine. I don't know about you, but we've had patients who have to do a maneuver to try to get the crystals in the ears aligned, when it might be pretty obvious that they need to be seeing a chiropractor and getting adjusted. The presence of cervical nystagmus is the main diagnostic tool for determination of cervical disequilibrium. Fantastic. As they say in here, is that the therapy of choice for the functional disturbance of the upper cervical spine is manual therapy. 1983, just a few years ago for you. I'll leave the link down below for you. This one's an interesting one. In practice, I've had many people come to me and ask me, well, what should I do? Should I do PT or chiropractic for my low back pain? Great question. We see, I don't know about you, but we see a lot of people in my practice who are referred to a PT before a chiropractor, and mainly because that's what's been done for decades. This is from Healthcare, February of 2020. Treatment of patients with low back pain, a comparison of physical therapy and chiropractic manipulation. The purpose of the study was to investigate the cost effectiveness of chiropractic versus PT in the US within 6 months of treatment and follow-up. They did data collection. They did data collection on Medline and PubMed databases were searched from 2000 to September of 2018. Both men and women aged 18 to 60 with a mean age of 40 years. All subjects had at least 3 weeks of low back pain over 6 months. 55% had chiropractic care and 45% had PT. Low back pain is a pandemic and costly musculoskeletal condition in the United States. Using physical therapy or chiropractic in the earlier stage of low back pain may reduce the utilization of expensive health services and lower the treatment costs. Key point right there. Lower back pain is the chief cause of years lost to disability in the world. Is the chief cause of years lost to disability in the world. Amazing, isn't it? In industrialized countries, low back pain causes a high cost of medical expenses and loss of work. Amazing. We can get people back to work quicker. There are costs and benefits with both PT and DC, but the question was, which of these treatments is optimal? As they quote in here in the article, while low back pain commonly resolves within 8 to 12 weeks. I'm interested in finding that full reference. The common one was that low back pain just went away by itself. And we know that is just not true. It can persist beyond 3 months in 15% of patients where it becomes a chronic pain. In terms of pharmacological therapies, the use of acetaminophen or non-steroidal anti-inflammatory drugs is recommended. However, drug, quote, care management does not heal patients. And therefore, non-pharmacologic therapies, including PT and chiropractic, once again, non-pharmacologic therapies, including PT and chiropractic therapy, are recommended. The overall number of visits within 6 months for the PT group was 20% higher than for the chiropractic group. Again, the overall number of visits within 6 months of the PT group was 20% higher than for the chiropractic group. The findings showed that the total average cost in the chiropractic group was lower than the PT group, and that the daily adjusted life years in the chiropractic group was higher. Awesome. Chiropractic care was shown to be cost-effective alternative compared with PT for adults with at least 3 weeks of low back pain over 6 months. Given these findings, as they state in the article, chiropractic care compared with PT is the cost-effective choice. This is an interesting aspect of this. I'm quoting the article. A survey. So what they're saying already is that some kind of manual therapy, some form of non-pharmacological therapy should be adapted and used, and probably first. And that chiropractic and PT is by far the best. And as I state in here, chiropractic is dramatically more cost effective. And chiropractic compared to PT is the cost effective choice. Interesting point I'll end with here is a survey of physiotherapists, I'm quoting the article, showed that they believe their training has not instilled them with the requisite skills and confidence to successfully address and treat the multidimensional pain presentations seen in low back pain. Then the question is, why are they getting referred to low back pain from the MDs? That's a good question. I'll leave the links down there for you. I wanted to start you off with an easy one this year. Welcome to 2021. Again, I'm Dr. Otto Janke for the Chiropractic Research Reports, sponsored by the New York Chiropractic Council. For more information, please contact the council at nycouncil.com. Let's get you great for 2021. Thank you much. We'll see you next time on the Chiropractic Research Reports.